Thank you for tuning in to Global Elite Consultant. If you have any questions about anything we talk about today, you could go to globaleliteacademy.net. That's globaleliteacademy.net. And fill out a form there, a contact form. We'll give you a call back within 48 hours. Or you can look up our phone number and just give us a call. And we'll answer any questions you have. We can always help you open up your agency, or we could just provide the policy and procedure manual. The policy and procedure manual is going to be anywhere from $2,500 to $3,500, depending on if you're getting the manual for the community-based program or just the agency. So if you need one-on-one help, we help you from A to Z. We help you get the license. We help you with everything. Your website. We help you with everything. We don't help you with marketing, but we do teach you how to market. We work with a company that he's really good with getting your website on the first page of Google. So we're going to refer you to him, but it's not included in our price because he's separate. He will also do your website, business cards, and brochures. So, and like I said, it's from A to Z. We just help you with everything. You have 1 year where we will be your mentor, basically. For 1 year, you could call and ask us questions or anything, any problems you might have. After a year, you will have to pay $160 per 2 hours slot. The price for the one-on-one training is $15,500. You would pay $5,000 down, and the rest of it you could pay monthly. And so go again to globaleliteacademy.net. So now what you have to do, you have to register your business. You must register your business with the Hawaii Department of Commerce and Consumer Affairs, which is DCCA. Choose your business name. What type of structure are you going to have? A LLC, a profit, or corporation, etc. File your articles of organization for your LLC or your article of incorporation for your corporation. Obtain your EIN number. You go to irs.gov and fill out the application. It'll give you the EIN number right there online. And then you'll have to register for the Hawaii tax account if required, tax withhold. And that's called GET, G-E-T. It's called G-E-T. Okay. All right. So like with in Hawaii, the licensing, they have rules and regulations. So they require for you to have the policy and procedure manual and information about your administrator or manager background check they want you to have, and the policy and procedure manuals. So now this is what they want you to include when you apply for the licensing. The administrator qualification and staff roles, the governing body and the ownership, the scope of service offered, operational and care policy and procedures, background checks on owners and manager, and quality and compliance system. Now, I doubt if they want you to upload all of this with the application, but they'll probably tell you on the website what to upload and what not. And I'll put the address to where you go get the license, where you apply for the license. I'll put it in the notes on this video. Submit the home care licensing application. So you're going to submit your application to the Hawaii Department of Health, the Office of Health Care Assurance. And the letters for that is OHCA. So you're going to complete the official state application, all documents that they're requiring you would upload. You're going to provide the background check for the manager and the owner. And you cannot offer service until you're fully licensed. So for the application fee is $1,200, and it's paid to the State of Hawaii Office of Health Care Assurance Special Fund. And it's $1,200. And your license lasts for 2 years. So you wouldn't have to renew to 2 years. And as you know, the fees are subject to change. After you get your license, after you submit the application and they process your application with the fee, the department may perform an inspection. Now, they may do it in person or they may do it virtual, online. They'll let you know what they're going to do. You have to display your license in your business. Then you want to hire staff and your training team. You have to conduct a background check for all of your staff and professional reference check. Provide training on personal care, safety, and client handling. You want to make sure your clients have that before they start. Ensure compliance with any state employment rules, whatever you have to do for that. If you are hiring CNAs, which are certified nurse assistants, or HHA, which is home health aides, they will require additional training because they're certified by the state, so they usually get state training. So make sure you have that information, their certification, if you're hiring CNAs. You want to make sure, again, that you're going to make sure you have your insurance, general liability, professional liability, and any workman comp if you're going to have your employees, unless you're hiring 1099 employees. If you're hiring 1099, you don't need the workman comp. But if you're going to hire W-2 employees, you need the workman comp. Okay, so make sure you so like I said, the license have to be renewed every 2 years. And they're asking, that you renew them early, at least 30 days before they expire, to avoid them lapsing. Okay, so now for this is for your regular license. So you'll be able to take private pay employees, private pay patients, and long-term care insurance patients. Those are the only type of patients you could take, when you open up your agency and you only have this application. If you want to apply for the community-based program where you could get low-income patients and the state pays you, you could do that. And you have to get that certification. That certification is separate. but you definitely can get that if you want to add on. I would definitely advise you to get it because when you're first starting out, new people have a hard time. I'm not sure why. I think because you're not, you don't be confident in what you're doing, but they have a hard time closing deals with private pay. So if you have the home care, home based in-home support, which is similar to IHSS, those a lot of those referrals they do come from marketing, but a lot of them also comes from, or some I'm gonna say, come from the social worker. And the social worker, you don't usually have to go out and do it. You do have to do an assessment, but I mean, they're not gonna scrutinize you. They'll just go ahead and give you the contract when you get them from the case manager. So those are easy to close those deals. You just go out and do your assessment, and then you're gonna close those deals. The one that are harder to close when you're new is the private pay, because you can't be stumbling over your words or anything like that. You have to be confident in what you're doing. We train you if you need help, one-on-one training. We will help you do that. We will help you get the license. We'll help you get the website. We'll help you hire people. We help you with everything. If you want us to help you, it's $15,500. You need to pay $5,000 down, and the rest you could pay monthly. You could pay the rest on monthly payments. Go to globaleliteacademy.net. Fill out our contact form, and we'll give you a call within 48 hours, or look up our phone number and give us a call. And we'll be happy to go over anything and ask you questions. If you feel confident that you could train yourself and do all this yourself, that's fantastic. But you still need the policy and procedure manual. So if you need a policy and procedure manual for Hawaii, give us a call and we can help you with that. The policy and procedure manual is going to run from $2,500 to $3,500. It depends. If you need one just for the non-medical agency, it's $2,500. If you need one for the community-based program, that's the program for low income, you need that's going to be $3,500. So just let us know. We're here to help you if you need it, if you need help. So I'm going to make another video on the IHSS program in Hawaii to tell you how to sign up for that and what to do. And again, the IHSS program is called different in every state, but it's basically the community-based program. And it helps you get patients that are low income. Because most of the patients that are low income, they cannot afford your service. So you need to get, help from the state. And these people will sign up with the state, with the program, and then the state will pay you a certain amount of money. I'm not sure what they pay in Hawaii. But when you sign up and everything, they'll send you the information on all that. In some states, when you file for the license, you can automatically file for the community-based programs at the same time. So our price includes the one-on-one, the $15,500. It covers both license, so we'll help you get both license. It covers the IHSS, or the community-based program, and it also covers the regular non-medical agency. So good luck with your agency. And like I said, the next audio would be opening up a IHSS, attached with your home care agency. Thank you so much for tuning in.